unconscious, but when I rub them in the sternum here or I pinch them up here, that they move when I do that. And then U is unresponsive. If they're unresponsive, we need to do a quick assessment and find out what's going on with them. They may have head injuries, they may have leg injuries. Another priority that we need to do in an accident like this is look for bleeding. We can come up and hold Robert's head, we can go down and look what's going on with all the bruises. But if we see bleeding, we're going to address that right away because somebody can bleed to death pretty quick. So you need to address that as soon as you get on scene. So here, I'm going to approach the scene. I'm going to make sure the scene is safe. And the first thing I want to do is, because he may have been hit by a vehicle, he may have fallen off his bicycle, my main concern is that he might have a head injury or a neck injury. So when I first approach Robert here, I'm going to come up and I'm going to tell him who I am. Hey Robert, my name is John, I'm a paramedic, I can help you. And I'm going to hold on to his head. If somebody's wearing a helmet, there's no reason to remove it. It may be helping hold his brain here in. So we want to leave the helmet on. If there's bleeding and you have to remove the helmet or you have to do CPR on somebody, then you may need to remove it. But right now, I'm going to hold his head inside this helmet. I'm going to ask him if he can hear me. Can you hear me? Can you hear me, Robert?
Yeah.
Yes. Okay, what happened to you?
I fell off my bike and got run over.
He fell off his bicycle and he's been hit by a vehicle. And asking those questions, they may be basic questions, but they let me know that he's alert and that he's doing well. He's doing pretty good. I'm going to be looking how he's breathing, see if he's breathing fast, if he's sweating. When somebody goes into shock, they're going to be sweating and they're going to be breathing really fast. And so we need to address that, and I'll address that in just a few moments. So I'm going to look down at Robert and see if there's any bleeding. I don't see anything right now, but again, if there was, I would address that immediately. I have somebody else that can help me, and I'm going to have Stephanie hold Robert's head here. Now, I've sent somebody to call 911. If you're alone and you have to call 911, you'll have to leave him. You'll have to tell him to keep his head steady. You don't want them to move their head back and forth because it might make the injury worse. But now I have another person here, another rescuer, that can help hold Robert's head, and then I can start a head-to-toe assessment. 911 has been called. There is no bleeding, and I'm going to ask Robert if he hurts anywhere. This is called the chief complaint. I'm going to go ahead and move this bicycle out of the way here. Robert, do you hurt anywhere?
Yeah.
Where do you hurt?
On this big bruise.
On the big bruise down here. So what I'm going to do is I'm going to go down there and address these bruises on this leg right here.
Yes.
Okay, so what I'm going to do is look and tell me, you're talking about right here?
Yes.
So what we want to do is we want to address this leg first because that is his chief complaint. Now when I'm looking at this bruise, it could just be a bruise, which is internal bleeding, or it could actually be a broken leg. The three ways we determine if somebody has a broken leg or a broken arm or hand is mechanism of injury. Now that is, Robert fell off his bicycle and he's been hit by a vehicle, and that could certainly lead to broken bones. Number two is swelling. If Robert has a swelling area right here, and it does look like it's swelling, he could have broke it. And number three is point tenderness. And that is, if I touch this, does that hurt when I touch this? So I'm not going to touch it anymore, but I might immobilize this leg. We might splint his leg using sticks or towels or phone books or any way that we can. We may do that to prevent movement of bones. When somebody has broken a bone in their arm or their leg and it moves around, there are blood vessels inside, and when those bones move, it could very well break those blood vessels and he may bleed internally. As a matter of fact, this bruise right here is an indication that he is bleeding internally. The bruise here is due to bleeding inside his leg, and as the blood leaks out of the blood vessel, it turns dark or black or red like this. So I'm going to go ahead and address this. We may splint this area here, which we're going to show you later. I'm going to ask you, does this leg hurt right here?
No.
Okay, good. Then I'm going to go ahead and straighten out this leg. Let me know if that hurts here, and I'm going to go ahead and straighten that out. Now, I've addressed this. I'm going to make sure that he immobilizes his leg and he doesn't move it. I'm going to address from head to toe, make sure that there's no bleeding. And now I can go back and start at the head and work my way down. Some of the signs we see that somebody has been injured can either be blown pupils or fluid coming out of the nose or ears. This fluid is called cerebral spinal fluid. Now typically what happens is if somebody has a head injury, the brain swells and it will push this fluid out of the nose or ears. Do not stop this type of bleeding because the brain is swelling, and if you close this off, it's going to put undue pressure on the brain. We can also look at Robert's eyes here. We're going to look at his pupils. If those pupils are equal, if they're the same size, that's a good sign. If one has blown or it's bigger, it could be a sign again of head injury. So we want to be aware of that and note that for the emergency medical service when they get there. So I'm going to look around the head for bleeding. I'm going to look in his nose. I'm going to look in his mouth to see that there's any broken teeth. Any broken teeth in there? Do you hurt anywhere in your mouth?
No.
Nope. I noticed that he has a bruise right here. That's something that's very, very important to indicate here. I'm going to check his shoulders. Now when you check for broken bones or dislocations, you want to look at the top here. Typically what happens with children when they fall off their bicycle, they'll put their hand out like this. And when they put their hand out, the shoulder will come up, the big bone here called the humors, and it will move up high and you'll see a divot in there. So I want to check for dislocated shoulders. I'm going to come down and I'm going to palpate. Palpate means to touch. When I check Robert for broken bones, what I'm doing is I'm wiggling his arm back and forth and I'm making sure that his bones are nice and sturdy, and I'm making sure that there's no bleeding, and I'm also taking note as to whether he has any pain or not. Now when I get down to this arm here and I get down to his hand, I can do a couple of quick checks here. I can actually take one of his fingers or his thumb and I can press on that thumb and the thumb will turn white, the fingernail, and then I can let that go. If blood returns to the fingernail after 2 seconds or less, this is an indication that Robert's got good circulation. That is, he's not going into shock. Typically in shock, the blood will pool to these areas and this capillary refill will be longer than 2 seconds, 3, 4, or even 5 seconds. So I can certainly see that his fingernails are doing good and that I push the blood out and it returns back in 2 seconds. Robert, do you feel me touching your fingers here?
Yes.
And that's a good indication as well. He can feel me touch his fingers, and that's telling me that he doesn't have any nerve damage in this area here. So now I'm going to go down through the chest here. I'm going to look at his stomach, make sure that there's no bulging or anything like this. If there's any bulging in the stomach, that could be an indication that his muscle tore in his stomach and one of the large organs is trying to press out. I'm going to do the same thing with the other arm. I'm going to come down, I'm going to palpate that arm here, and I'm going to check capillary refill on this hand. And then, do you feel me squeezing your finger? Perfect, he does that. And now I'm going to do the same thing with the leg. Now I'm going to be very careful about the uninjured leg, or the injured leg I should say, in that I don't want to hurt him any worse because that will increase anxiety. So again, I'm going to go down, I'm going to make sure that this leg, just let me know if this hurts here. And then what I can do is I can ask Robert on this uninjured leg here if he can push down on my hand. Go ahead and push down. Perfect. And then I want you to pull up. Now by doing this, by having Robert push his foot down and pull it back, this is also letting me know that he has got no nerve damage, in that his spinal cord, his brain, everything is working well, and he's able to move his toes, move his foot back and forth. And of course, do you feel this as well, Robert? Do you feel me squeezing your toe? So he feels that. So our best course of action right here is that Stephanie's going to maintain this spinal immobilization on Robert's head. We're going to immobilize this leg because of a possible broken leg. We can't treat any bleeding because Robert's not bleeding, and all we can do now is comfort Robert and wait for the emergency medical team to get here. So when we're back to Robert here, if we think that he broke his leg, the best course of action is just to keep it immobilized until emergency medical services get there. They've got the professional splints, the inflatable splints, that they can immobilize this leg, immobilize Robert to a board, and transport him to emergency services. But if you have time or you're camping and you can't get emergency medical services up to you, you may have to do something. You may have to invent a splint. Certainly it's simple enough to purchase a splint. This is called the SAM splint right here. The concept of this splint here is that it's aluminum with padding around it. And what you can do is you can just fold this over and make it as rigid as you want, and you can run this along the broken bone. Now the idea of splinting is to immobilize the bone so that the bones don't move back and forth and cause any further damage and also pain to your victim. So the concept is that when you splint somebody, you want to mobilize the bone or joint below and the joint above. So if we thought that Robert broke his leg right here, which is the tibia and the fibula, and then this is the femur right here, if we thought he broke a bone here, we want to immobilize his foot all the way up to his hip. And the same thing if he broke this bone right here. So what you would do in this case is you would make this as long as possible. You could put this on the inside and wrap it around his foot. You always want to splint bones and legs and limbs where they lie. So if he had broken his bone, and let's say that it had turned out this way, you don't want to straighten it out. You never want to move that part. You always want to splint it. And if you have to use padding to splint this, then that's what you want to do. So you want to move it as little as possible because there'll be great pain, and also it can cause bleeding. So we can use the SAM splint and put it in this way. Now certainly if you don't have something like this, then you can use something that you can find around the house, whether it be towels or phone books or blankets or even sticks in the backyard that I'm going to show you here in a moment. You could even use the other leg as a splint. If you're going to use the other leg as a splint, you want to pack towels in the center here. You want to put towels here because what's going to happen is if I use this leg to splint this leg, I'm going to move this leg over towards, so you always move the unaffected leg over towards the affected leg. And then the towels will help fill in the gaps here. And then what you want to do is you want to tie these two legs off. Keeping in mind, of course, if you're camping and you need to get out of there and you splint both legs, it's going to be difficult for Robert to walk. So sometimes it's better to use other splinting material. So in this case, I'm going to use a stick that I found out in the backyard. Now, if I see that he's got this injury right here, I always want to place the splinting material on the opposite side because you don't want to put the splinting material on top because obviously that's going to cause a lot of pain for Robert. So I'm going to go ahead and put this stick in the center here. And then what I'm going to do is I'm going to take some wrap material here. I'm going to take some gauze or triangular bandages. I'm going to move this here first. And I'm going to go ahead and set these under his leg. Now notice that I'm taking these triangular bandages or these bandages and I'm sliding it under his knee. There's a natural gap underneath his knee so you don't have to lift up his leg. And what I'm going to do is I'm going to scissor these down into different parts of his leg so that I can use to secure the splinting material. So I'm going to go underneath here. I'm going to go up here. And I'm going to make sure and secure this in at least 3 different places. It's very important to make 2 ties right where that break is as well. So I'm going to take note where this is, and I'm going to go up a little bit higher so I don't go on that break. Now I'm going to go ahead and put my splinting material in there. And then what I'm going to do is when I place this down here is I'm going to make the tie. Now you may want to run this around the leg 2 times. You can actually make two passes around the leg. And then when you tie this off, you want to actually make the tie right on the side of the splinting material. And the reason you want to do that is because if I make this tie up here, it's going to put pressure on his leg. So the tie or the knot should be right on the piece of wood or phone book or blanket or material that you're using. So I'm going to go ahead and make these ties here. And then the second one is going to be here. And again, you may want to loop this around 2 times to make sure that it's going to be secure. So I'm going to make that tie here. Are you doing okay, Robert? Yeah. Okay, good. You always want to talk to them. Let them know what you're doing. Don't surprise somebody with something that you're going to do, especially when they're this age. They have a lot of anxiety. They want to know what you're going to do, and really they want to know if it's going to hurt. Now that's something I can't really tell them because I don't know if it's going to hurt, but you want to be careful anyway. So I'm going to make a couple of ties here. Now that I've immobilized this leg here, I should take the pressure off of him moving back and forth and maybe make a little bit of less pain for him and actually a little bit safer as well. Now after you make this splint here, you want to make sure that he still has feeling in his toe. When I did the initial assessment, I found that he could feel me squeezing his toes and his fingers as well, and he had good capillary refill. Down here on this foot here, I want to make sure that he can feel his toe still. And the reason I want to do that is because once I put this splinting material on there, I want to make sure that I didn't do something that's going to cause him not to have feeling in his foot. So once you do something, check it out. Make sure that he's still got feeling and things are still working good for you. We might even take Robert's sock off and check capillary refill. Now, because he broke his leg here, I would expect him to have a delayed capillary refill here, in that the vessels may not be circulating as well through this leg. So we might expect that when we push his toe, if we take his sock off, I'm going to go ahead and pull this sock off here. If we pull this sock off, we might expect him to have a capillary refill of maybe 3 or 4 or 5 seconds. So always check that before and during and after you do procedures like this. Let's talk about heat exhaustion. Now, Lori's an athlete here, and she's been running, and she may have a case of heat exhaustion. The first thing I note is when I come up to Lori is that she's sweating. It looks like she's in athletic attire here, and that she's sitting down and she's having trouble catching her breath. So same thing, I'm going to come up, introduce myself. Hi, my name is John. Can I help you?
Yes, I think I can't catch my breath.
You can't catch your breath. What happened? What were you doing that you can't catch your breath?
I was running.
Okay, so you were running. And do you have any type of medical problems, any medications that you're on or anything like this?
No.
So we're going to establish that this is not something else, and it could be a heart attack or a stroke or some sort of medical condition that she has. We want to make sure that she is just suffering from what's called heat exhaustion here. So the signs and symptoms of heat exhaustion is high level of activity, of course. She might have what's called an altered level of consciousness. That is, she's having difficulty talking to us. I see that she's sweating profusely. She's hot to the touch. In doing vital signs here, we can do a couple of things. We can check pulses. If we check pulses on the hand here, if you want to see what a heart rate is, you can actually go down the thumb here and check the pulse. Now, on the thumb side of the wrist here, if you put 2 fingers into this area here, you should be able to feel how fast the heart rate is going. A normal heart rate on an adult is around 60 beats per minute. So if you were to check your own pulse and you counted for about 30 seconds and your pulse was 30, you could double that and find that your heart rate is normal. In somebody that's suffering from heat exhaustion, we would expect the heart rate to be somewhere around 100 or 120. So if Lori has given me the okay to treat her, I can go ahead and I can look at for obvious skin signs here. I see that she's sweating. She has no medical alert bracelet. Always look for medical alert bracelets that could cue you in as to what other sort of medical condition that she might have. But she said she was running. She's sweating. She looks like she's sweating. She's hot to the touch, and I'm going to check her pulse here. And I note that her pulse is about 50 times 50 beats here. I count 50 in 30 seconds, and if I double that, that's going to be 100. So 100, 120 I would expect if she was in heat exhaustion. Another thing that I note is that she's sweating profusely and that she's breathing really fast. Typically people breathe about 12 times per minute, adults, and children breathe about 20 times per minute. So if Lori's trying to catch her breath and she's going and she's breathing really fast, this is another sign that she's either going into shock or she has heat exhaustion. So what I can do for Lori in this heat exhaustion here is we can do a couple of things. We can, one, take her out of the hot environment. It's a hot day, she's been running, she's sweating. So the first thing I'm going to do is have her get up and move to a cooler environment. Number 2, I can give her sips of water. We can have her drink water or some other type of fluid replacement. Never alcohol or coffee or anything that has caffeine in it, because that's a diuretic and it's only going to reduce the amount of water inside their body. So water or things like Gatorade is the best treatment here. And so she can drink those. Now if I wanted to cool her down, what I want to do is, if I was going to cool Lori down, we never want to throw water on anybody anymore. Used to be that when we would cool people down, we could throw copious amounts, large amounts of water in their face and all over their chest. And what they found out is when you're using large amounts of water, can actually cool them down too fast and actually slow their heart rate down and can be very dangerous. So with Lori here, what I can do is I can just take a few 4x4s or a rag, and I can just get a rag a little bit wet, and I can cool her down slowly. I can cool her forehead down, I can cool her down around her neck and around her arm as well. And this is a better way of cooling somebody down. Now, should you call 911 here? Typically when people have heat exhaustion, they don't need 911. If you can sit her down in a cool environment and in 10 or 15 minutes she starts to feel better, her heart rate goes back down, her respiratory rate goes back down, and she tells you that she feels better, you may not need to call 911. If she starts to get worse or she doesn't get better in 10 or 15 minutes, then you'll want to make that call. You know, anytime that we find somebody that has heat exhaustion or has been injured or is ill, they usually go into what's called shock. Shock is a very generic term. When your body goes into shock, what happens is that once the body goes into shock because of injury, or in Lori's case, heat exhaustion, the vessels will dilate, the blood vessels. And when the blood vessels dilate, a lot of the blood pools down into bigger areas like the stomach. And so what happens is your heart will start beating faster because it's trying to compensate for the loss of blood up in your brain and in the vital organs. So the first thing that happens that we note is the heart rate picks up speed. That is, it'll be anywhere from 100 to 150 beats per minute. The second thing that happens, because there's more blood that needs to be pumped around, the heart goes faster, it needs more oxygen. So your body responds by increasing your respiratory rate. Now, Lori may be breathing fast because she's been running, but she may also be breathing fast because she's in shock. So the heart rate's going to go fast, she's going to be breathing really fast. And another thing that we can do to help her out in shock is we could actually lay her down. So if we put her in a cool environment and we were to lay her down, and I'll show you this right now, I'm going to go ahead and lay Lori down. I'm going to put her down on the ground like this, and then what I'm going to do is I'm going to raise her feet 10 to 12 to 14 to 16 inches. And by doing that, by raising the legs, it'll allow the blood to pool that's normally down in her stomach to go back into her vital organs where she needs it. And even a hot day like today, we may even cover Lori up, because what happens is, now that we've cooled her down, she may start to shiver because she's going into that shock state. So the heart rate will be fast, the respiratory rate will be fast, and she may even complain about chills. And in that case, we'll cover her up. So here, if we're going to raise her legs here, because we're not worried about any broken legs or anything like this, we can go ahead and take anything that we find around the house or at work, and again, we can raise the legs 12 to 14 to 16 inches. And then this is what's called a space blanket. This is a very lightweight blanket that you can use or have in a first aid kit. You can, of course, use any blanket or towels around the office or at home, but something like this is a little bit more efficient because it's designed to hold the heat in. So I'm going to go ahead and open this up, and I'm going to cover Lori up. And I'll cover her up all the way up to her head here. And then I can kind of tuck this around, and that should store all that heat in. And this is a typical shock position. You can do this for anybody that's been injured, that's you feel is going into shock because of illness. The exception to the rule is when people are having respiratory difficulties. In later parts here, we're going to talk to you about asthma and things like that, where people are having trouble breathing. You would not lay them down in the shock position. So we talked about heat exhaustion. The next thing, or the worst thing that could happen from a heat-related injury, is what's called heat stroke. Now what happens is when you have heat exhaustion, when you have been exercising or working out, your body's going to sweat, and it sweats so that your skin cools off and it cools your body down. So as we saw with Lori earlier with heat exhaustion, she had a high respiratory rate, her circulatory rate, her pulse was fast, she was sweating profusely, but she was able to talk and drink water. So we put her in a cool place and we didn't need to call 911. But now we're looking at Lori, and it looks like she's not sweating anymore. And in heat stroke, what happens is your body can no longer cool itself down. So typically what we see is, and we have to kind of decide what's going on, we knew that Lori was working out. We see that her clothes are still wet. So she's been exercising and the sweat has still saturated her clothes. But when I look at her face now, I note that it's dry. She's not sweating anymore. And that when I use the back of my wrist here on her forehead, that I note that it's very, very warm. When somebody is red in the face, they're dry and they're warm, these